Welcome. Thank you for joining our Best Practice Series webinar. I'm Becky Melody, your hostess for today's presentation. Dirk Rogers, founder of RxTrace.com, and Grant Hodgkins, Vice President of the USDM Commercial Practice, which includes our track and trace and serialization practice, will be presenting. The discussion today will cover introductions, webinar logistics, and our discussion topic, Drug Supply Chain Securities Act. Have you heard the latest news? We're proud to have Grant leading the USDM track and trace practice, in addition to leading the ERP, MES, PIM, PLM, and other enterprise solutions. Grant has 3 decades of life science industry experience designing, implementing, and managing complex global programs and operations. Grant also served as key industry action committees mobilized during the development of track and trace technologies in several countries. Dirk is a pharma supply chain thought leader and founder of the RxTrace.com, where he writes regularly about the pharmaceutical supply chain with the focus on track and trace technology, standards, and regulatory compliance. Dirk is also author of the Drug Supply Chain Security Act Explained. USDM is focused exclusively on the life science domain. We're the market leader in providing quality and regulatory IT compliance professional service solutions. We're headquartered in Santa Barbara, California, and we've delivered more than 1,000 successful projects with over 300 life science clients. We offer hands-on experience in assisting clients under regulatory distress, and we're the market leader for validation accelerator packs. Our various dedicated practices include global quality and auditing, IT and virtualization, life sciences cloud, GRC, laboratory, which includes systems and equipment, ECM, ERP, PLM, enterprise quality management, manufacturing automation and equipment, clinical and drug safety, business intelligence, project management, and of course the track and trace practice. The content today will be covered in approximately 30 minutes, and I'd like to share a little bit more about Dirk Rogers as well. Dirk helps clients prepare to meet global serialization for the track and trace regulations. His focus is the meaning and implications of the regulations, the technology standards needed, strategies for applying those standards to meet various regulations, and solution vendor selection. His expertise includes operation of the modern pharma supply chain for manufacturers, repackagers, wholesalers, and pharmacies, business models of the brand, generic, virtual, and contract organizations. Okay, there is a Q&A session involved in today's presentation, and we'll invite you to enter the webinar questions in the chat area, and they'll be addressed immediately following the presentation. We also invite you to join us for the discussion on the USDM LinkedIn page, and we're also happy to address questions directly if there's anything of a confidential nature. The agenda includes an overview of the DSCSA regulation, the recent DSCSA news and updates, what this news means to the legislation, your strategy, your direction for your business, and of course, what should I do next? We're happy to address pain points and offer direction and support. And then we'll wrap up with the Q&A. Appreciate y'all joining us today, and with that, I'll turn the presentation over to Grant.
Hello everybody, this is Grant Hodgkins at USDM. So we're going to start with a very simple quick poll, and we'd like to know if you'll click any or all of the items that are on the screen if you've heard about any of these different new news items. We're going to talk about some of them as we go through the conference, but if you'll take a moment and just click on your screen if you've heard about the new FDA data exchange workshop that just recently occurred, the draft guidance on suspect products that the FDA recently published earlier this week, I believe, the HDMA ASN guidance that came out recently, some brand new news on the GS1 traceability guidance that's been updated, and then finally, just announced a day or two ago was the FDA webinar that they're having on suspect products to follow up on their draft guidance document. Okay, so we'll give you one moment here to click away. And Becky, do you want to do results now or you want to do them at the end?
Let's do them at the end.
Okay, good. So we're going to move on to the next slide, and I'm going to introduce Dirk Rogers, and he's going to give us all a quick overview of the regulation itself and get us all on a level set, and then we'll move on to the news items and implications. So, Dirk, take it away.
Thanks, Grant, and thanks, Becky. Hi, everyone. This is Dirk Rogers. As many of you know, I talk and write about the DSCSA a lot, and I think a good way to fully appreciate it is to always keep a very high-level summary of the law in mind. So for manufacturers, here is my 1,000-foot view of the DSCSA. There's a lot more to it than this, but for manufacturers, these are the most important elements in my view. The law was enacted on November 27th of last year, and that's important because the effective dates of its many provisions are based on the date the Act became a law. On that date, the clock started. For example, one of the first things that had to happen was the publication by the FDA of draft guidance on the handling of suspect product and notifications of illegitimate product. The law gave the FDA 6 months to publish that guidance, and they only missed the deadline by a week or two. The next big thing that will occur, based on the date of enactment, is another draft guidance that the FDA must publish on the one-year anniversary. That draft guidance will be to establish standards for the exchange of transaction data. The DSCSA applies only to finished dose packaged drugs intended for human consumption and which are required by federal law to be dispensed only to patients who possess a valid prescription. That is, the law applies to prescription drugs only. One of the most important features of the DSCSA is that it preempted all state and federal drug pedigree laws as soon as it was signed into law. This feature is probably the most important reason the industry was willing to support the passage, because it immediately eliminated the California and Florida pedigree laws, along with all of the others. The core of the law consists of escalating requirements over a period of 10 years, starting next January and ending theoretically on November 27th, 2023. I say theoretically because a lot can happen over a 10-year period, and because, as we'll see in a few minutes, it is not yet well defined exactly what will happen in 2023. But we do know that starting next January, companies in the supply chain can only do business with trading partners that are authorized. That is, their trading partners must hold a valid state or federal license, whichever is pertinent. It will be up to each trading partner to confirm that their suppliers and customers hold a valid state and federal license at the time of each transaction. Also beginning next January, sellers of drugs in the supply chain must supply specific data about the transaction to the buyer. Both the buyer and the seller have obligations in this requirement, and both must retain the transaction data for 6 years in case of a future investigation that requires that information. For manufacturers, the next big escalation in regulatory requirements comes on November 27, 2017, when they will be required to begin doing the following. First, they must apply a unique serial number to all of their drug packages and shipping cases. Second, for the first time, the transaction data they supply to most of their customers must be in electronic form. Third, they must respond to requests for verification for drugs they sell into the supply chain, responding within 24 hours. And then on November of 2023, the regulations finally transform into a new system that Congress calls the Enhanced Drug Distribution Security System. I have a whole slide for each of these last 4 bullets. Let's take a closer look at the requirement for sellers to provide buyers with data that describe the change of ownership transaction. The data must be supplied in 3 distinct sets, starting on January 1st, 2015. Starting on that date, the data must be supplied in either paper or electronic form, although whenever a manufacturer sells a drug directly to a healthcare practitioner, the law requires the manufacturer to supply the data in paper format only. It's also important to note that even though the DSCSA allows companies to provide the transaction data in paper format to others, the large wholesale distributors are asking for all of their suppliers to start out with an electronic format, generally either EDI advanced shipment notices or GS1 EPCIS formatted messages. Make sure you check with your customers to confirm that they will accept your form and format, and do that soon since you may need to make adjustments before January. One of the large wholesale distributors is claiming that as early as November 1st of this year, they may begin to embargo products that arrive with incorrect transaction data until the seller sends the corrected data. That's coming right up, so you have to move quickly on this. As I said, the transaction data must be supplied in 3 distinct sets, known as transaction information, transaction history, and transaction statement. The transaction information is a set of data that describes the current change of ownership transaction and includes data about the product, such as NDCs, lot numbers, and expiration dates, and data about the transactions, such as transaction date, the shipping date, the company from whom ownership is being transferred, and the company to whom ownership is being transferred. The transaction history is simply the collection of each transaction information that has been passed down from each change of ownership in the supply chain since the manufacturer sold it the first time. Of course, most drugs sold by the manufacturer will not have a separate transaction history, since the transaction information they supply describes the first change of ownership of the drug. Finally, the transaction statement contains 7 distinct assertions or attestations that the seller must make about the veracity of the product contained in the shipment and its history. Not all 7 will apply in every situation, and for some wholesale distributors, an 8th assertion will be added, but these are all specifically called out in the text of the DSCSA. On November 27, 2017, most of the transaction data supplied by manufacturers must be supplied in electronic form only. The exemption for paper when manufacturers sell directly to a practitioner will remain. And again, because the larger wholesale distributors are being so insistent that the data they receive being electronic from day 1 next January, this regulatory requirement should be fairly inconsequential by late 2017, but we'll see. Now let's take a closer look at the serialization requirement of the DSCSA. As I said earlier, by November 27, 2017, all drug packages and homogeneous shipping cases must be serialized. Repackagers have a comparable requirement by November 27th of the following year. The unique serial number must be placed on the product package in both machine and human-readable forms. The machine-readable symbol must initially be a 2-dimensional data matrix barcode with the SNI, lot number, and expiration date encoded. Shipping cases may use either a 2D data matrix barcode or a linear barcode to contain the same type of information. This same information must also be shown in human-readable form. Manufacturers must retain information about the assignment of lot and serial numbers and where the lot numbers are shipped for a period of 6 years. The DSCSA does not require manufacturers to provide aggregation data to their customers, at least through 2023. Aggregation data is the serial number-based containment hierarchy of a given shipment, and it is used for sellers and buyers to allow them to identify exactly which package level serial numbers are contained within a given serialized container without needing to open that container. However, to meet the DSCSA, there is never any need for companies to do that, so aggregation data is not even an implied requirement. But I also contend that manufacturers will be better off collecting aggregation data for their own internal use. You just don't need to provide it to your customer. I've written a number of essays about this controversial topic on RxTrace recently, and because it is so controversial, I recommend that you check with your customers to find out whether or not they believe they will need aggregation data to comply. If they claim they need it, you might suggest that they review my essays and on why they really don't need it, and hopefully they'll see the light. It seems to me that too many people focus their attention on the transaction data and serialization requirements of the DSCSA, and they forget about the requirement to respond to requests for verification, as the DSCSA calls it. For manufacturers, this requirement starts on November 27, 2017. The requests can come from state or federal investigators or other members of the supply chain. The DSCSA defines the term verification as determining whether the product identifier affixed to or printed upon a package or homogeneous case corresponds to the standardized numerical identifier or lot number and expiration date assigned to the product by the manufacturer or the repackager. These requests will be made whenever a wholesale distributor receives a returned drug that they wish to resell, and whenever anyone in the supply chain determines a drug to be suspect. So manufacturers must be prepared to respond to requests that arrive using either the serial numbers or a combination of the lot numbers and expiration date. Their response must be that they did or did not produce that product with that serial number or that lot number and expiration date. These responses must be made within 24 hours until late 2023. Don't overlook the complexity of this required capability. The frequency of requests will probably be small most of the time, but in the event of some nationwide concern in the supply chain, the frequency could skyrocket overnight. Think about what might have happened when people were concerned about the integrity of Avastin a few years ago, or heparin before that. Finally, on November 27, 2023, 10 years after the DSCSA was enacted, the law will transform into something else. Exactly what that is, we don't really know yet, because the law requires the FDA to work with the industry in the meantime to figure out how it will work. But we do know a few things. We know that for the first time, the serial number, referred to here as the SNI, must be included in the transaction information that the seller provides to the buyer. The transaction history will no longer be necessary whenever a change of ownership occurs. All data exchanges must be electronic, so even individual practitioners must be able to deal with electronic data exchange by then. At that time, the verification must be performed in a new way, which is not really defined yet, and responses to information requests from state and federal regulators must be performed promptly rather than the 24 to 48 hours that you can get away with prior to 2023. Now we want to provide you with the latest news related to the DSCSA and the industry's preparation for its implementation. The FDA held a workshop on May 8th and 9th to help them collect ideas for the draft guidance they are required to publish by November 27th on data exchange standards. They made no announcements and did not offer any significant hints about which direction they are going. However, they did publish their notes from the event, which highlighted some of the things they heard from the audience. On this slide, I've listed just a few of the things they included in their notes. They noted ambiguity in the transaction information, including the proprietary or established name, the container size and number of containers, and the date of transaction and the date of shipment. In the transaction statement, they noted ambiguity in the need for an abbreviated statement, how to verify that trading partners are authorized, how companies can avoid false transactions, and avoiding knowingly altering the transaction history. On June 11th, the FDA published the draft guidance on suspect product and notifications as mandated by the DSCSA. This guidance is based on the FDA's experience investigating suspect drugs over the years. It includes good advice on how companies can detect drugs that are suspect, including a list of scenarios that increase the risk of acquiring suspect drugs, and recommendations on how to identify suspect products. The DSCSA requires companies in the supply chain to quarantine and investigate suspect drugs to determine if they are illegitimate or not. Those found to be illegitimate, whether counterfeit, adulterated, stolen, diverted, or subject to a fraudulent transaction, must be the subject of a notification to the FDA within 24 hours. The DSCSA also requires manufacturers to notify the FDA whenever there is a high risk of illegitimacy. Companies are then required to notify the FDA whenever the situation is resolved, including a description of how it was resolved. The draft guidance provides a new form, Form FDA 3911, to notify the FDA of all of these types of actions. Some of you may be aware that the HDMA, the Industry Association of the Large Wholesale Distributors, published guidance back in April that explained a standardized approach for using EDI ASNs to comply with the electronic passing of transaction data. But since then, HDMA members have pointed out a few deficiencies in that original guidance. And so the HDMA is currently working on another update to that guidance, which they hope to publish sometime in July. The update will include a clarification of the ship from, ship to, and sold by, sold to data elements, including new codes and usage notes, some shipment level compliance edits, the inclusion of the direct purchase statement that wholesale distributors need, and the examples will be updated to reflect these updates. Not to be outdone, GS1 Healthcare US is also working on multiple updates to their guidance for the application of GS1 health standards in the U.S. serialization and traceability regulations. Version 1.0 of their guidance was published last year, and it was aimed at meeting the California pedigree law. Version 1.1 is due to be available in July. It will be the first update that is aimed specifically at the DSCSA, and it will cover the lot level traceability that is necessary for DSCSA compliance on January 1st, 2015. Its primary focus is on the use of GS1 EPCIS standard for electronic compliance in place of EDI. Not many companies are likely to use EPCIS by next January, but for those who do, this will be an indispensable update. Then they are already working on another update that they are currently calling version 1.2, which will address how to use EPCIS to represent a mixture of lot-based and serial number-based product traceability. This will be important for companies who use EPCIS as they begin to serialize their product in advance of 2017. More and more companies will have that need in the next few years. This update is targeted for sometime this fall. Our final news item is the recent announcement by the FDA that they will hold a webinar to go over their recent draft guidance on suspect product and notifications. It will occur on July 1st at 1 p.m. Eastern Time. You can register at through the URL on this slide, and if that time isn't good for you, well, then they post a recording on their website at some time after the event. So with that, I'm going to turn it back over to Grant. Grant?
Okay, thanks, Dirk. So just a little bit more deeper dive into the news. So Dirk did a really great job of covering the basics and then highlighting some of the news items. So a little bit more on some of these things. So I think we can all expect that there's going to be future FDA guidance coming out. I would not expect it until late in the cycle, November, December. It's really unclear if some of the controversial things are going to get resolved at that time or not, but we have to all keep our fingers crossed, and I would encourage people to continue to send comments into the open dockets, and let's try and get some of these issues that were on the previous slides highlighted to get addressed. On the other hand, the HDMA ASN standards, we think, are going to resolve most, if not all, the technical questions. But again, until the underlying data questions get solved, we're going to have a means to transport the data around, but the meaning of some of the individual data elements may be a little unclear. So I think that in the law, there's a set number of FDA workshops that are required, especially out in the future. Let's hope that there's additional work, either through guidance or workshops this year, to get some of these underlying questions addressed. But that's, kind of anybody's guess as to what exactly is going to happen there. So I'm going to move on and talk a little bit about what this means to you. So you've seen the reg, you've seen some of the news items, and fundamentally what this means is that some of these more difficult and controversial questions have not been answered. So specifically called out is in the transaction information, the TI, what do you put for the name exactly? What do you put for container size? What does it mean exactly? What are all the different dates in the transaction set? What do those mean exactly? And then the transaction statement itself, what text do you put in there? What does authorized really mean? And what are the implications of what authorized means on some of these elements like aggregation and things like that that the customers are going to be asking for? So you need to watch this space for especially the HDMA ASN changes that are coming. That's going to be a key area of how you adapt your systems to communicate to your trading partners. In the meantime, obviously, implementation work is going to continue, so you need to build some mechanisms into your project plans so that if something changes late in the game in October, November, December, that you're able to rapidly react to that. I cannot overemphasize that point. So in terms of what this means, what do you have to do now? I think you have to stay the course. You've got project plans. If you don't have project plans, you need to get some, but you need to set out based on the unknowns, you've got to set out a plan. You've got to go after that plan. And that plan's got to be flexible. This is going to change. It's not going to be static. And think of this is only the beginning. So January 2015, we all get to take a pause and say, that's great, we got something finished. But that's really the start of the journey. This is a long-term, 10-year initiative. So this is milestone 1. As I said, you're going to have to be adaptable. There's going to be changes. You're going to have to, after you go live in January, then it's probably going to take several months to work out the bugs, work out the kinks, and then you're probably going to want to do another round of improvements to make your operations smoother with all these new things that have been added. Stay informed. So you need to keep up with, we've given you different venues. You got GS1, you got HDMA, you got FDA resources. There's news events like we're doing today. Stay plugged in, know what's going on, stay informed, make your adjustments to your schedule based on the best available knowledge. And then it's really hard. You've got to stay positive in all this. It's really hard. It's frustrating. Things change. Management yells at you. But this is no different than any other regulation that we see in life science. It starts out a little fuzzy. Industry gets together. There's dialogues with the agencies. It gets worked out. It gets clearer. Everybody learns together, and it gets better. So, how we can help specifically, our kind of shameless marketing pitch is that, partnering up with Dirk Rogers Consulting, I think you see we've got a grasp on not only the U.S. regulation, but also the global regulations. And we can provide full service solutions from regulatory consulting to helping you plan your implementation strategies, building and executing all the various moving parts, helping with validation, quality management, et cetera. And then, of course, there's Dirk's excellent book, The Drug Supply Chain Act Security Act Explained that's available on his RxTrace website. There's 188 days, basically, before this regulation takes effect. So if you think about it, there's a lot to do. There's not a whole lot of time, and it's going to take a significant effort on everybody's part. So before we open up for questions, I'm going to slide back here to look at the poll results. So give me one moment here, because I think I have to do it one by one. Go back here. Okay, so here's quick poll results. So that was actually very interesting to see that a fair amount of people had heard about a lot of these things, but the webinar, I guess, since it just was recently announced on the suspect products guidance, not a lot of knowledge of that. So I hope you at least learned that one thing today from our webinar. And then we're going to open this up for questions. They're in the chat panel, so if you have a question, then please type it in the chat panel and we will respond to it. So in the meantime, we're going to open up for questions. Becky, do you want to read out some of the questions
Absolutely.
that we have received?
Absolutely. We'll jump right in. So our first question is from Paul, and he's asking if Dirk could speak a little more to why we feel aggregation is not necessary.
Sure. That's a good question. In fact, like I said, I've written quite a bit about this with a more complete explanation of why I believe that. But I can sort of give you an overview. First of all, aggregation is not an explicit requirement in the regulation, and that's really what I'm saying. It's not a requirement of the DSCSA. Explicitly it's not in there for the first 10 years. It's not an implied requirement either, because no one really needs to know. There's no requirements in the law that force companies to know exactly which serial numbers are inside which cases. So that's it in a nutshell. The whole value of aggregation to downstream trading partners would be for non-regulatory purposes. So, and I believe the biggest value will come to the manufacturer more so than to downstream trading partners. So, hope that answers the question. If not, just check out that RxTrace essay.
Yeah. So Dirk, this is Grant. So I'm going to add on to that. What makes this controversial, and has always been controversial, is yes, it's not required by the regulation of the law. However, it's all hinging on what does the term verification mean, and how is it really going to be interpreted not only by the agency in more guidance, but also, as Dirk mentioned, by the customer. So if you have a customer that says, for example, you ship me, a case of 48 items, and you send me a transaction information that says I've got all these different serial numbers contained in this thing at some point in the future, then if I find out later that one of those serial numbers actually wasn't in that container and there's an error, then are they liable under this verification? So I think that's why there's still confusion, but I think there may be the ability for all of us to engage with groups like GS1, with HTMA, with pharma, and some other industry groups, and try and get aligned around some sort of a message that says, here's how we're all going to jointly interpret this and do business in this interim period.
Thank you. Okay, so very good. Our next question is from Jitesh. He's stating that there's still no clarity on the electronic data exchange format. How will data be provided from ERP systems?
Yeah, I can handle that, I think, and Grant, you may have some thoughts on this as well. In fact, this is kind of the problem with the fact that the DSCSA mandates the FDA to provide or establish standards in draft guidance by November 27th of this year, and then the industry can follow that guidance starting January 1st, only a little more than a month later. And admittedly, that's just too much time, too little time for companies to react. So what's really happening today is that the large wholesale distributors, large and small wholesale distributors, and pharmacies are sort of dictating to upstream trading partners exactly how that electronic data can be received by them. And that's why we end up with things like EDI ASNs being modified to include the data elements that are included in the DSCSA, those 3 sets of transaction data. And also EPCIS being updated with guidance that tells you how to fit those same kind of data elements into an EPCIS message. And then in theory, you could also supposedly use an electronic invoice or an electronic packing list in order to do it electronically. But you really have to check with your immediate trading partners to confirm that they are willing to accept your product with that whatever technology you choose to do it electronically. So you're right. No one can tell you what it has to be until either the FDA speaks or your trading partners tell you. I can tell you, though, that whatever the FDA comes out with, it will be in draft guidance, which is not binding. So as long as you are able to comply with the law as the law is written, that's the important thing. So if you come up with and your trading partner accepts some way to encode the information which is included in the law as being required, and doing it electronically in some way that ends up not being mentioned in the FDA's guidance, you should still be okay.
Very good. Thank you. Okay, our next question is from Arun. As per the GS1 regulation, can application identifier have parentheses encoded in the barcode?
Yeah, so Becky, I'll take that one. So a couple things on that. One, the GS1 is just a set of industry standards, so it's not a regulation, so I want to be clear about that. So the second part is, in the GS1 standards, the parentheses are really only for human-readable interpretation. They're not encoded into the actual data stream that's in the barcode itself. It's an artifact that shows the display for humans to help you differentiate where is an application identifier start and stop, and where is the data that's associated to that application identifier. So I hope that clarifies the question a little bit.
Thank you, Grant. Okay, we have a question from John asking for more elaboration around the transaction statement assertions, asking, are they supposed to be standard text statements that appear in the TS? Has everyone agreed on a standard language, or is each company free to choose their own language? Follow-on question, is there any group such as HDMA that's trying to coordinate everyone's language to minimize confusion here?
Oh, that's an excellent question, and it's really a tough thing to answer because you're really getting close. You're really getting to the point where it's really a legal question. And so what we find is companies are involving their legal departments in order to interpret the language in the DSCSA to figure that to answer that question. So I can't really provide an answer other than to say yes. HDMA has had their I can't remember what they call them. Their wholesaler members, I think is what they call them, get together to try and come up with an abbreviation to those 7 assertions, 7 plus 8 plus 1 to make 8 assertions. And they came up with the phrase DSCSA compliant, which I know of other suppliers, manufacturers whose legal departments believe that that's way too short, too terse, and that they believe that something in between that DSCSA compliant and those 7 full assertions are what's needed. But the problem is, you're right. Other than HDMA doing what they just did, there is no one that I'm aware of. Grant, maybe you know someone who's sort of coordinating an agreement among the industry on how to abbreviate that without putting in what if you put in everything that's in the DSCSA text around transaction statement, you've got over 550 characters of text, and that would have to occur so frequently that it would be really a waste of data space. So that's the argument in favor of abbreviation. But how to abbreviate it is really it's almost at this point it's almost every company's own choice. But the problem is that if your legal department believes one wording is what's necessary, the question is, will your customers' legal departments agree that wording is acceptable? Because they have to be concerned about accepting something that is valid in what they are interpreting. So it's a real problem. So Grant, do you have any thoughts on that?
Yeah, there's a couple of things. One, if we're going to continue to have these 550 character things, which may evolve to, when you get the lawyers in, 22,000 characters, then I'm buying all kinds of stock in disk storage companies. But I think that this is kind of what I was mentioning earlier. It's tied to that. I think that after January 1st, I think you're going to see a settling out period where people are going to go back and look at what they had to throw together to meet this regulation timeline. And over the next several months, I think that the first 6 months of the year in 2015 is an opportunity for some industry groups to get together and say things like, well, if for this assertion, I'm the customer, right, and I'm seeing 52 different manufacturers and they all have some statement that doesn't look like one another, so then they're going to have a difficult time making sure that all the assertions are there that are supposed to be there, and which one really meets this requirement versus this other requirement. So I think it's a natural point for there to be some coalitions forming with the different industry groups to say, we really need to get control of this, and can we all get together, write a guideline, agree, and then, it's obviously voluntary, but I think it would have a lot of power coming from a group like HDMA to say this is recommended best practice.
Wonderful. Thank you, gentlemen. Next question is from Susan. Is EDI the only electronic format that's likely to be acceptable to the majority of trading partners? Are there other options?
I think I can do that. In fact, we mentioned EPCIS also, following the GS1 Healthcare US guidance, which is coming out here in next month. So that's another approach. However, like I said, also, I think only a very small number of companies are likely to use that, at least on day one in January. You also have to be concerned whether or not the large wholesalers are willing to accept EPCIS. I know actually two of them have announced that they will take it. A third of the big three, I don't understand their response. So it may be that they will accept it, they may not. So check directly with all of those. Other than that, you could consider an electronic invoice an electronic method of transferring, but I suspect also you'll find that the wholesalers may try and dissuade you from using electronic invoices to carry things like lot numbers and the other data that's required, the transaction statements and things like that. So.
Very good, thank you. Follow-on question from Jitesh. When you say returns of products, are you referring to batch recalls?
No, I'm not referring to batch recalls. I used the phrase returns once in my presentation, and that was regarding when a wholesaler receives just overstock inventory returns from a pharmacy ordered too much, or for whatever similar reason they chose to return to the wholesale distributor the product that they purchased for credit. The wholesale distributor can make an evaluation to determine whether or not that product is still sellable or saleable, as they call it. And as long as it is, there's nothing apparently wrong with the product, it was not open, that kind of thing, that they are able to resell that product. And when they do that, they are required by the DSCSA, starting in, I believe, January, to send a request for verification to the manufacturer to confirm that that lot number. Oh no, this is starting in November 27, 2017. The request for verification occurs. So that's the kind of return I was talking about. So that's part of the DSCSA language.
Very good. Thank you for the clarification, Dirk. Okay, Randy has a question. Do you believe the HDMA ASN become part of the ANSI-12 standard? ANSI standards, yeah, sorry.
Well, in fact, no. But what I can say is that the HDMA guidance makes use of existing standard data elements that are part of the ANSI X12 standard. So it's sort of the other way around. Because HDMA is already using data elements that already exist in the standard, there's really no reason for them to go backtrack into the standards organization to get them to standardize those, because they're already standard.
Right. So, this is Grant. So if you think about it, the ANSI X12 standards are there that dictate how the messages flow, what goes in the messages, what all the segments mean, and all those kinds of technical details. And then HDMA basically said for healthcare, and specifically for DSCSA compliance, here's some recommended usages of those elements that are already in the standard to kind of standardize the content elements that get encoded in that structure, so that everyone knows what they mean and what to expect, to hopefully make it a little bit easier on the IT side to interpret the data that's coming through that standard transaction set.
Thank you. Okay, Jessica's asking if there are any additional FDA webinars, workshops, or outreach efforts that have been announced in support of DSCSA.
Yeah, so this is Grant. So there's the new one, that was just announced this week. Beyond that, I'm not aware of anything else that's on the books except for the guidance document that's due in November. Dirk, do you know anything else?
No, you're talking about other. I apologize. I was reading another question while you were speaking that one. Was it about other webinars and that kind of thing?
Yeah, other webinars or guidance documents, workshops.
Yeah. No, in fact,
I don't think anything's been announced.
Correct, and especially from the FDA, they have to be very careful about their announcements and their documents they release, and so that's why they make a big deal about the timing and that kind of thing, and getting approvals. So we're expecting the release of that draft guidance on November 27th or earlier. They're going to try and do it as early as they can. And then you probably will see these kinds of webinars that really will just go over the same information that is contained in the documents that they've already released, because they have to be very careful about saying anything that they haven't already said publicly in a formal document.
Thank you. Okay, I have another question from Arun asking when the barcode has data string of 01/21/17-10, how can parsing be achieved to just pick up from an 01/21, especially as some countries have different serial number lengths? Hope that was clear, gentlemen.
Yeah, I got that one. That's
Go ahead, Grant.
Yeah. So in the GS1 standards, they tell you there's rules for how to take a certain application identifier like a 01 or a 21, and there's some constructions that tell you how to pull the data apart, especially if it's embedded as part of a string where you had a G10, you had a lot, an expiry, and a serial number. And so Arun's question is, if I just want to look at the G10 and the serial number, and the serial number is variable, how do I pull that apart? And so I'm not going to get into the technical pieces of it, but there's a combination of two things. There's either that something's fixed length and something's variable length, and then the second piece of that is where that variable length appears in the barcode. If it's at the very end of the string, then the string terminator tells you that's the end of the string. If it's in the middle of the string, then there's a function 1 character that gets inserted at the end of that string to terminate it so that you know how to stop your system and tell it that's the end of the 21 data set. So I hope that's clear. But Arun, you're welcome to reach out and we can talk separately if you need to.
Thank you, Grant. Appreciate that. Okay, so question from Tom. He is asking, what happens then between 2017 and 2023? What do I need to do to be prepared for or to plan for my budget and strategy overall plan?
Mm-hmm. Well, in fact, between 2017 and 2023, that's during a period of time when a lot of requirements are coming in at the wholesale distributor, repackagers, and pharmacy space. So for manufacturers, there's not quite as much to do during that phase of time, except to work with the FDA and the rest of the industry to try and define what will happen on 2023 during that shift of into that new type of security system. So.
Thank you, Dirk. Okay, another question from Susan. Are the required data elements in the data matrix for 2017 consistent with the previous guidance document on SNI from a couple of years ago? If not, how is that likely to be reconciled?
Yes, in fact, they are consistent. The SNI guidance, talked about GS1 standards, using GS1 standards, although they did not go into much detail there. They simply pointed out that you could use GS1 standards in order to generate what the FDA considered an SNI, Standardized Numerical Identifier, which they also call a serialized NDC or SNDC. So yes, the data elements referred to in the DSCSA, they refer to the SNI, and they are referring to that same standard that the FDA published in non-binding guidance back in 2010.
Yeah, and sometimes the confusion comes in because it doesn't necessarily exclude your ability to put more information in the barcode. So for example, lot and expiry, not necessarily specifically called out. The SNI guidance focused more on a G10 and a serial number, but it didn't preclude your ability to add more elements. So I think that's where it was actually cleverly written to be able to deal with this situation where now the regulations require something else in addition. So I think it's still consistent, but it might be something that we all recommend the agency go back and update to make it completely 100% tick and tie to the actual regulations so there's no confusion going forward.
Thank you. Okay, we have a request for clarification, verification from Paul. He's asking, is there any guidance regarding standards, formats, or content?
Oh, for the request for verification, no, there is not. And in fact, it's not even, the request for verification, they don't even specify whether that has to be electronic or could be a phone call. They talk about the manufacturers deploying creating systems to be able to respond to requests for verification. My interpretation of the word system is not necessarily that it has to be a computer system. We're used to thinking in terms of the word system meaning computers. I don't think that was the intent, but that's just my opinion. You have to read the language yourself and decide whether or not what they're really talking about there is a system. But part of the problem is they use that term in places where they're referring to things that have to happen on January 1st, 2015, and that's just way too soon to be able to deploy a computer system to do whatever it was that they were talking about at that time. So that's where I determined that, in my own opinion, that the word system in the law could be interpreted as being standard operating procedures. So just a process has to be created to be able to respond to these requests for verification.
Very good.
Yeah, and you said something really interesting in the presentation on this point, Dirk, that this is not a trivial matter. We all got some experience with this in the Florida pedigree, where you had to have the ability to respond to a customer's request for pedigree verification, information on the pedigree, verify the pedigree, and it takes an operation, and it takes somebody manning the phones. It takes the ability to pull up the information that you need quickly, and then to develop some sort of a template or standard or internal mechanism to be able to quickly respond to that and turn it around with without having to get like an IT analyst or a business analyst or some high-level person to do all the work to pull that data together quickly.
That's right.
Good. There's a follow-on from Paul asking, what other FDA guidance documents would it be reasonable to expect this year and next year as we get ready for the 2017?
Well, the DSCSA for this year only specifies the guidance for data exchange this year. Now, next year, I think there's they have to come out with guidance for, I believe, something about repackaging, and also they have to come out with a list of licensed wholesale distributors, I think, by the end of next year. I don't know of any guidance off the top of my head, but again, I'm more focused on what comes up for January 1st, so I haven't really on the top of my head what's the guidance. Grant, do you have any? Can you answer that question better than I have?
Well, yeah, for the end of this year, aside from the one document that's in the reg, I don't know that they're going to have time to come out with anything else. I mean, it would be lovely, but I have my doubts. I think there might be some other mechanisms, FAQs or something like that. I think that some of these things are going to have to get ironed out a little bit better. But honestly, I think a lot of this is going to go to next year, and I really expect a big part of next year to see a lot of settling out of this. Not only to clean up some of the things that couldn't get resolved now before this go live, but also now the distributors and all the other players that start to have dates coming up, they're going to be asking questions. There's going to be guidances on the docket there that probably are going to have some impact on the previous draft guidances and whatnot. So I expect a lot of movement here.
Yeah. In fact, we saw this with in California, where some of the more sticky questions didn't even rise to the surface for several years, and then finally they started to rise. These questions started to rise that were just really hard to answer. And it was only the Board of Pharmacy in California that would have to answer them, but they really didn't even understand the question. So we may see a little bit of that, and so you may see some impromptu guidance or FAQs, as you pointed out, coming out at any time, maybe not soon, but starting this fall and going on at any time. But what I was referring to is what is mandated by the DSCSA, because there are a certain number of guidances that are mandated and other types of events that are mandated. But obviously, they could do more than what is mandated. So, and we won't know what those will be until the moment they arise.
Okay, and I think with that, gentlemen, we better wrap up. It's been a very exciting discussion here. Thank you, Dirk, so much for joining us in this presentation, and well done, Grant, sharing solid information. And thanks, everybody, for taking the time to join us here as we stay at the forefront of compliance issues. We do welcome any questions again from you. I would let you know the session has been recorded and will be available on our website so that you can share with colleagues and return for information again as questions present. Do let us know if there's anything that we can do to address pain points with you or offer direction and support. We have some information there on screen. Shoot us a note at usdm@usdm.com. Our website, of course, usdm.com, and our phone number is there posted for your use as well. We do appreciate the time here with you, and we appreciate the opportunity to team with you all in working towards excellence and compliance. Have a wonderful day.